All right, hello, welcome once again. My name is Curtis with Dental Intel, the leaders of business intelligence for dental offices. I got my main man here, Adam Smith, who is one of our data analysts, and he's got something exciting to share with us. It's called Re-Appointing within the dental office. How are you, Adam?
Doing great.
Good. So tell us what you got here.
So as I've been looking at a lot of different practices, one of the main things that we're noticing, one of the strongest trends with practices that are successful is how well they maintain their active patient base. And most people think that they do this a lot better than they actually do. And I want to demonstrate really quickly, it works the same way as compounding interest does because of how you keep patients. But I want to demonstrate the difference that a small change in that number can make in your practice. So being the numbers geek that I am, I'm going to pull up an Excel file and show that to you really quick. So let's say your practice gets, you can see I've titled each of these columns years, new patients, patient base, and patients that you retained. Let's say your practice gets 360 new patients a month, average of 30 per month. That's pretty average. Some are a lot better, some are not as good, but this is just to demonstrate the importance of that number. So obviously, if you get 360 patients, new patients in year one, you get to see 360 patients. That's your active patient base. If you reschedule at 90% for each of those hygiene visits, I'm actually going to change that to show you at first the difference. Let's say you reschedule at 80%, which is actually where most practices reschedule their hygiene. They think that it's better, but it's typically in the 80% range and to the lower side of that. So let's say you reschedule 80% every time they're in the chair. That means since you saw your patients twice in the first year, you retained 230 of them. So the next year, you're going to add those 230 to the 360, and you're going to get to see 590 patients in year two. So I'm just going to drag this down for the sake of time and show you what would happen to your patient base if you continued to reappoint at 80% always for 15 years, growing at 360 new patients a year. If you look, you've pretty much plateaued by year 7. Year 8, between year 8 and year 9, you added 360 additional patients, and you got to see 10 additional patients. That's you're kind of stuck, and we see that all of the time. Somewhere between year 5 and year 10, depending on reappointing, people get into a plateau, and they're wondering, even though they're getting new patients, why they're not growing, and that's the answer. So now I want to show you how this works like compounding interest. Let's say you keep the same number of new patients and you change the way that you reappoint in hygiene from 80% to 90%. Remember that bottom number there on year 15, your patient base is 999. So all I'm changing is that we reappointed at 90% rather than at 80%. I'm going to drag that down, and that 999 changes to 814. So a difference of 10% in reappointing, because it works that way, almost doubles your active patient base. And if you look, you're over 999 by year 4, which means you've grown twice as fast, because we hit 900, about 900 at year 8, but you have grown twice as fast by reappointing 10% better. This is one of the strongest correlations in successful top 10% practices in the United States. So if you're having problems growing, you're probably saying, I need more new patients. In reality, this is the number we should be working on, is reappointing and hygiene.
That's pretty cool stuff there, and it's pretty obvious when you're able to see that right within the on the numbers, right down that spreadsheet. And I mean, numbers don't lie. That's what we preach. That's what we talk about. That's how our doctors not only grow, but how they increase their lifestyle. Adam, thanks for taking a few moments. I know you got another doctor you need to be talking to about his numbers here shortly. But if you have any questions, feel free to write them in the comments below. And we hope you guys have a great day. And remember to lead your practice by numbers. Thanks, Adam.
Yeah.